Chief of Department of Transplantation Surgery at the Aristotle University School of Medicine in Thessaloniki, Greece. And the immediate past president, and George had more than one term as for the World Body, and really shepherded the World Body through the COVID years, really, which really transformed how we did business and how we held meetings and how and really how we functioned. So George did a great job. Congratulations on that, George. And I think you're going to reflect on some of the lessons learned from that experience, so please.
Thank you very much for your kind words and most importantly for your help throughout these years. And you, as well as many of the members of the U.S. section who have been critical in getting the college through honest discussions and very tough topics. So I really appreciate this. So we're going to talk a little bit about leadership, what it really is, and then a bit about the lessons learned, which really translate into the beatings that that includes. And how do you move it? Okay, good. So the meaning of leadership, some of the theories that exist, why is it important to us? And that's really going to be one of the key issues. How is surgery different in leadership issues, traits of a leader, and then some of the principles. So what is leadership? What it really comes down to is that there isn't a single definition, but the idea is that a leader has two tasks. One is to set up a goal, define the goal, define what they want to happen, what they want to achieve. And the second task is getting the whole team motivated enough to work towards that goal. So these are two basic key concepts of leadership. And what kind of goal are we talking about? It can be all sorts of things. It can be getting a man on the moon. It can be winning a world war or ending a war. It can be solving a problem of cancer. But it doesn't have to be just big goals. It can be, planning the financial status of a family, finding a solution to the emergency department working better in your hospital, finding better ways to run your operating room. It can be on all different levels, the goals that we set. There have been throughout time many theories about leadership, and of course we originally had the one where you're born a leader, and this had to do with people being born and being kings, and that meant that it was hereditary. So in order to be a leader, you had to be born to a certain family, grow up in a certain household, and it goes from one generation to the other. And of course, time proved that not to be the case. So we had to ask ourselves, are there other characteristics? Does a leader have to be tall? Does a leader have to be blonde? Does a leader have to be strong? And again, we saw that this is not really the case. What is the case is the personality and the behavior and the traits, and whether the leader can do some of the tasks we talked about, finding a goal and trying to accomplish that goal, which really means, all the theories mean that leadership is not one thing, but more importantly, it's not hereditary, and it doesn't have to do with specific traits. And all of that means one thing, that actually leadership can be taught. Leadership, you can become a leader. You're not born a leader. It's something that can be achieved. So the next question is, how do you achieve that? How do you get to that point? And there are many different ways to create a leader. One can be personal experience, and this starts right from the beginning of life. We all belong in different groups, whether it's teams you play in at school, whether it's a classroom, whether it's university, whether it's training, whether it's residency. We all belong in different groups or associations, which essentially are training grounds for leadership. personal study. So it's not just something abstract. You can read about it, not just the theories, but read about examples of people throughout time. You can observe. And when you observe means observing not only the good things, but especially the mistakes. That's even more lessons there. And practice. And this is a key thing. Practice does not mean that you have to wait till you become president, or you become a minister, or you become, the leader for global society to practice leadership. You can practice leadership in your own home. You can practice leadership in your own operating room, in your hospital, in your area of work, in your social group. And that's a key concept. Environment affects leadership and, of course, the need. And that's also important because a lot of times we don't realize the need for a leader or even our ability to become a leader till there is a need, till something pushes us. In terms of study, there are many great books. These are some. We'll talk about one of them a little bit more. And there are many examples, which, again, can be at all different levels. It can be in politics, it can be in medicine, it can be in associations. And, of course, there are examples to avoid among leaders. And these we can sometimes learn much more from. And, of course, in order to become a leader, you need a mentor. You need someone who will guide you there. And that relationship is not an easy one. It's not a passive one on both sides. So the person who's going to be led needs to actively look for that mentor and identify that mentor and build that relationship. And of course, a mentor doesn't mean we'll meet for an hour in my office every 6 months. It's a very active, it's a very elaborate process with a lot of work. Practice means participating in different associations, identifying our environment and how that works. So, an obvious question is, why should we care? That sounds great, but why is it important? It's important because its leadership plays a role in all levels of our professional lives. It has to do with how we provide health care to the patients, to our patients. It has to do with the bureaucracy that we face during our everyday work, and even just in the operating room. And the key is that, as we saw, by leadership being something that's practiced, taught, everybody in this room, at one level or another, can and perhaps should become a leader. Because an easy way to think about it is, if you don't do it, someone else will lead for you. So there come times that we actually have to take these initiatives and be prepared. But are we ready? Do we ever get taught in medical school or in residency how to become a leader? No, we're taught surgery. We're not taught what the so-called soft skills. This is changing, but we're not there yet. And it goes along all the different things we're not taught us. How about financially plan your future, how to become a teacher, how to become an educator. We're all expected to teach residents, but nobody tells us how to become an educator. We're not trained as teachers. So that's one of the things we're not ready for. And it's important to incorporate these non-surgical skills into the ones that have to do with surgery, which kind of brings to the values. And these are things that are changing from autonomy and authority and claim. And again, these are words that ring true in surgery. And this is how we learn surgery. This is changing over time to talking more about cooperation, talking about data, evidence-based medicine, transparency. And there is a global need for leadership, and this is, you'll see a lot of association, whether it's American College or different college, where they actually start having the seminars, how to train people. And it has to do with the quality movement in surgery, and has to do with the fact that the surgeon's role is changing. And we all know about the triple threat or the quadruple threat, but the truth is that it's not just the clinical work. In order to showcase that, in order to help the patient, you need all other different levels. And again, different levels of leadership. It can be at the bottom. It can be at a higher level where the decisions are made. It can be a very high level where the higher up you get, the more lonely it gets. So basic concepts. Leadership is a positive trait. It's something good. It comes both from personal and society's needs. It can be exercised and should be exercised at several different levels in our everyday environment. And everybody can and should become a leader at one point or another. Now, how is surgery different? Surgery is a very difficult area for leadership. Why? Because in surgery we're taught about autonomy. Through medical school and later, you learn that you got to be the best. You got to be number one. You got to be better than everybody else. You don't learn how to collaborate. You don't learn how to cooperate. You learn how to excel. You learn how to distinguish yourself. That doesn't make it easy for learning about leadership. You taught about independence, autonomy, but these are things that don't always go along with good leadership. And the surgeon doesn't want to be controlled, but at the same time, we don't want to relinquish control. We want our patients to do something. Why? Because we told them to do it, because it's good for them. So, not always easy as team players, and we hear about a lot of the bureaucratic words that gets us a little bit scared. So it's not, it needs a change of mentality in surgery. And we've all gotten used to surgery not really being a democracy, and empathy, something you gotta avoid. This is all changing because these have to do with traits in leadership which are important even more so, and the non-clinical skills. So the fact that it's harder in surgery, and it's not something that we're taught, or it's not even necessarily encouraged, doesn't mean that it shouldn't be part of surgery. It just means that there really is a much bigger need for it in surgery. What are the characteristics of a leader? All sorts of values which are very important, but really what is the key is the moral part, the ethical part, because that's your moral compass. You can be an excellent surgeon, you can be an excellent tactician, you can be able to make money out of nothing, but if your moral compass is not right, then that can create problems. And of course there are different types of leadership, and you have to adjust. You don't just use one depending on what your group is, whether you're in the operating room, where you really cannot be too democratic the whole time because you got to look after the patient, whether you're with a group of residents, whether you're a group of patients. You have to adjust your style of leadership according to your audience. And of course, always got to remember the big picture, and that is key. The principles of leadership, which a book by Attila Hanward, 10 principles. The heart is more important than the mind. And that was something that Attila said with the chiefs must cultivate empathy. And although it's weird to hear about that word from someone with his history, it's key. Basically means put yourself in the other person's shoes. If we can all do that, then we will be in a much better position of leading a group because we will understand their needs. Second principle is, for success, you need many types of leadership. And of course, that's understandable. You need to identify the best strategy for the specific group and for the specific goal. The footprint is more important than the size of the foot. That has to do with what we leave behind us. And that's key because your legacy as a leader is going to be your students, it's going to be your patients, it's of course it's going to be your family, but it's going to be many more. It's not the CV. And a big part of it is whether you've actually trained someone as a future leader. And that's very critical. And that's not very easy always to do because if you're going to do it well, that means that you're going to mentor someone, you're going to show them all you know and much more. And if you did it really well, then be prepared to be overtaken Be prepared for that person to do better than you. And that's not an easy feeling, but if that happens, it means you did something right. Respect what is holy, learn the traditions of the place, and respect them. It doesn't mean you need to accept them, you can change them, but do it with the right pace. Use the favors wherever you go to a new place. You always get some favors. It's your chance to ask for certain things. So be careful what you ask for, because that's going to be your best chance. Leadership does not have to be lonely. Make sure you have friends. Make sure you identify people who will help you, and that's key. And the leaders always lead the army in the battle. You got to be in front. And that's not always easy, because you cannot be perfect in everything. A lot of times that is what may be required of us, and that's how why it's important to make sure we have people that will help us. And of course, incentives for the members of the team. People will follow you if they have incentives. So you have to identify. They're not always financial. They got to be many different things. It's important to identify what these are. And it's a challenge to serve two or more masters. Now, Attila didn't have that problem, but we all do, because we got to serve whoever could be the department chair, or whoever is the medicine chair, or whoever is the university, the dean. So different levels, different people we are accountable to. And that's not always easy, and we have to be very diplomatic. But we always have to remember what our primary mission and goal is. Do not try the impossible. Make sure your goals are realistic and planned at different stages. I'm going to skip this. Go to the more personal lessons learned. So some of the lessons learned, we were in a different environment. It was a Greek university, and that has good and challenging parts. And you had the culture. Surgery is pretty much an international culture of how things are run. The other problem was the timing, the environment we talk about. When I took over, it was January of last year, which was in the middle of the COVID crisis, where hospitals in Greece were all basically out of work. That the department, the transplant department, did not exist. We were all over the hospital. Didn't have our wards, didn't have our nursing personnel, didn't have our ORs. Half of our personnel was in COVID units helping. So everything was upside down. The good news when that happens is that it can only get better, chances are. So, but the environment plays a role in things. So when you're going to go to a position of leadership, it's good to prepare. How do you prepare? Learn about it. Learn about the position, learn about the place, the traditions, the philosophy, learn about the people that are there, the good and the bad. Also, make sure that you identify, or you start identifying people who will help you. Get advice from other people and plot the course. Try to identify mentors that you can go for advice. Never be too proud to ask for advice. And also define your mission. Define what you're good at and what you can do, and what are your priorities in a place. Is it the clinical work? Is it research? Is it social work? What you're going to do for the place or the community? Is it management? Identify what your mission will be. And also identify how the department works. And that includes your whole role changes from purely clinical one to one where management becomes increasingly more important. That means you got to learn about the financial, you got to learn about the bureaucracy, you got to learn about all the paperwork, and you got to accept that that's part of life. And your role, you cannot go and hide in the operating room all day and say, I'm a surgeon. It changes, and that's a big change both on several levels. So you need a lot of help for that. You have to identify the goals of the department, what the bosses want from you, and what you want, and how you can put these things together. Also see who's your audience for different things. The first thing is consolidate your team. Make sure your team, your people, your department is behind you before you go outside to ask for things. Don't talk much in the beginning, just look, listen, learn. Very key. Get all the information. The key is always information. And don't rely on what other people tell you. Have your own perspective. They tell you someone is good, bad. Go and find out for yourself. You know, we're all different how we judge people. And observe before making any changes. We may think we have the perfect plan for a place, but learn what can happen and what cannot happen. And identify the people who will work the best for you. Find your advisors and set your goals for next year, the immediate ones, 5 years, 10 years down the road. It all has to be planned. Change of roles we talked about. And have friends in low places, that's key. If you're going to make things work, if you're going to run things, you need to have friends with the coordinators, you need to have friends with the nursing personnel, you need to have friends in the janitorial stuff. You need to make sure you know the details of how a place works and go and talk to these people because they're the ones that will make your life much easier. Build alliances with other people, other departments that want the same things with you, and have patience. Don't always go with your first instinct. Your first instinct, you may think you're right, could be to attack when something that you think is wrong. But don't always go with that first thing. Wait, think, and you'll find when the time is right to do something. And measure your strengths and mainly your weaknesses. Nobody's perfect. We all have weaknesses, and it's good to know them and work on them. Treat everybody as a family in there. Build those relations, whether it's outings, whether it's social events. Treat them as a family. Learn about their families. People, this is a key thing. And try and build an identity in the department. Try and give them a sense of belonging somewhere. How do you do that? Things like whether it's a website, whether it's a uniform, whether it's a badge, whether it's a logo, doesn't matter, but give them a sense of belonging. And the whole idea is make everybody better. We talked about mentoring, how it is. You got to make sure that people in your team advance at all different levels, that the nursing personnel in your department gets better and advances. When people feel that that's what you're aiming for, that that's how you want to help them, they'll be more active partners in this. And don't see your other people there as a threat. They're not a threat. They can be there to strengthen. And you'll have challenges. You'll have the difficult colleague. That's going to happen no matter what. That's where you start using the empathy. Learn about what's motivating them or not, and see if you can address things. That may not always be possible, but try and find what the strength of every person is and use that. And keep records, of course. Okay. And I'm just going to move ahead in the interest of time. Things to avoid: don't make the hasty decisions. One trauma surgeon used to tell me, right or wrong, I'm certain of it. Once you make a decision, go for it. Don't show doubt. And avoid corruption or moral deficit. That's a key in what you do. That's the one thing that can really hurt a leadership position. And be there. Don't be absent. Be there at all times. So in conclusion, everybody can and should, to a certain extent, at a certain level, be a leader. And the current environment and the challenges that surgeons face internationally, not just in the U.S., it's really all over the world, make the need for leadership even more important. And in order to do that, we have to understand the meaning and the traits of leadership, but what's really the key, we have to understand set the goals, how to get to those goals, and that don't wait till you are the president to become a leader. Do it, start in your own operating room, start in your own working environment. The need is there. Thank you very much.
Thank you very much, George. In the interest of time, we'll move on to the next speaker, but clearly you've learned some important lessons and you've shared with us a lot of, really important material. I think, unfortunately, most of us, we lose, we learn from our own mistakes, but there were many sort of wise words there. Thank you very much, George.